Call this meeting of the Board of Health to order today, Friday, November 17th at 12:01 p.m. and we will start with roll call.
Jamie Steeg, Avish Nagpal, Arlette Preston,
Here.
Kayla Nelson, Lynn Telford,
Here.
Neemal Day,
Here.
Bernie Dardis,
Here.
Grant Severson, Tony Grinberg.
Here.
And I'm not sure if we had the online link for, we don't, okay. Okay, sounds good. We will start with approval of the agenda for today's meeting.
Move to approve.
I'll
Second.
second.
All in favor, aye.
Aye.
Any opposed, same sign. Motion carries, agenda is approved. Next up will be approval of the minutes from our August 11th meeting. I will seek a motion to approve those minutes.
I would like to approve August 11 regular meetings.
Any second?
Second.
Thank you.
All in favor, say aye.
Aye.
Any opposed, same sign. Motion carries and the August minutes are approved. And we can add Jamie for attendance.
Apologies for my tardiness.
It is okay. And then also Lori sent out the proposed schedule for 24 meeting dates. If you guys have had a chance to review those.
Move for approval.
I'll second.
Okay, all in favor of the 2024 meeting date schedule, please say aye.
Aye.
Any opposed, same sign. Okay, motion carries, 2024 meeting dates are approved. And now we will review our growth plan brief.
Hello, right here. I'm Kim Satrowski with the Department of Planning and Development. Thank you for the invite to share a quick update on the growth plan. Last year, the city started working on the growth plan, which will guide how and where Fargo should grow in the future, which will replace the last growth plan, which was adopted in 2007. That 2007 plan focused primarily on growth on the edges of town, but this planning effort will look at the city as a whole. So we're exploring places where we can look for growth within the city, redevelopment areas, and on where community preferences are on the edge. So I know you have seen some emails, and I appreciate you participating in the various exercises, and just wanted to remind anyone, if they haven't already, that we have an online survey that closes at midnight tonight. So you can visit fargogrowthplan.org to share preferences on how and where Fargo should grow. Thank you.
Any questions on that growth plan survey? I have really appreciated being able to contribute to that.
I had asked Kim to come and share with you guys a little bit. I know that when we forward out those emails to the Board of Health, and so I just wanted to make sure that you guys all knew the purpose behind it and that your participation and awareness was really valuable to have. So, and Arlette, you've been very active with the growth plan as well. And I don't know, did you want to talk a little bit, Arlette, about that walkability
Sure.
piece and health?
That would be great. So what does this have to do with the Board of Health? I think it's got a lot to do with it. In regards to the design of neighborhoods and how it impacts community health, the health and well-being of our residents. So, I think I see such a strong interaction between how neighborhoods are designed and the health of the community. And I think just being involved in this process helps to bring that point forward. It's certainly a long-term vision, but the whole issue of walkability has a direct impact on physical health, as well as the interaction of the neighborhood, neighbors between neighbors, makes for certainly more healthy community as well. So thank you for keeping us in the loop.
Yep, agreed.
Thank you all again.
Okay, our next item on the agenda is health officer update.
Hello, Board of Health. Happy Friday. Have our technical wizard help me here. That's not you. I would have never figured it out. Okay, can we just do like presentation mode here? This guy. Nope, I'll do it. That guy right there. There you go. All right, thank you. Okay, thank you for having me today. I was just gonna give you guys a quick update, maybe talk about something a little bit different today. I wanted to highlight a new Surgeon General report on the epidemic of loneliness. This has kind of been an interesting, our Surgeon General released a advisory about the healing effects of social connection, kind of like you were just mentioning, actually, Arlette. And this, we're kind of learning through research that connection plays a critical role in individual, community, and societal health. And so this advisory really calls attention to that role and offers a framework for how we can kind of all contribute to improving our social connection. So Dr. Vivek Murthy, who is our U.S. Surgeon General, he really calls for kind of specific action in this. He lays out a framework for how we can all do our part. And specifically, they make recommendations for various groups. There's things we can do as individuals, things we can do at the local government level, within our workplaces, of course, our health systems, and then within community organizations. So what are some of the physical health consequences of having poor social connection? This report points to some research that says people have a 29% increased risk of heart disease, 32% increased risk of stroke, a 50% increased risk of developing dementia for older individuals, and then an increased risk of premature death by greater than 60%. So pretty substantial effects. That was physical. What about some of the mental health effects on loneliness and isolation? We know that being lonely doubles an adult risk of developing depression, and that's building on the fact that currently more than 1 in 5 U.S. adults are living with some sort of mental illness. And then in childhood, isolation and loneliness can increase the risk of anxiety and depression, both immediately to the child and in the future as an adult. And again, from a baseline of knowing that more than 1 in 3 of our young adults are living with some sort of mental illness. So this was really striking to me, and the concept that addressing loneliness is really a critical part of fully addressing the current mental health crisis that we're experiencing in this country. And so we know that, research shows that social connection not only benefits, like I said, individual health and communities, but communities actually fare better on several measures as well. So for the individual, some of the things we've already mentioned, we can have, improvement in things like heart disease and stroke and your risk of depression or dementia. But communities that are connected continually fare better on numerous metrics. So things like population health, the safety of a community resilience when needing to respond to some type of natural disaster or catastrophe, overall prosperity, and just a greater level of civic engagement. So again, this report just kind of laid out a nice framework for ways that communities can advance social connection. I thought I'd touch on a few of them here. So the first was really encouraging communities to try and strengthen their social infrastructure. So this would be things like enhancing our community physical spaces, our parks, our libraries, our playgrounds, places where people gather. It also encouraged strengthening programs and policies that we have in place at the local level, looking to strengthen our social infrastructure. So really being mindful, it's funny as we talk about the growth plan, of designing environments that would promote connection with our citizens and really trying to invest our resources in institutions that purposely bring people together. And then it looked to enact pro-connection public policies. That can be done, of course, federally at the state level, but really locally too, and even as granular as like tribal governments all play a role. So really looking to proactively establish policies that support things like public transportation that's accessible to all, support things like paid family leave. And then looking to mobilize our health partners, right? We know that loneliness is a risk factor for several of the health conditions I just showed you. So trying to partner with our healthcare providers, they're really well positioned to assess individual patients for risk of loneliness and then hopefully connect to, them with resources as needed.
Dr. Newman, if I could just interject a comment here, if
Absolutely,
you go
yeah.
back. So, relating to the growth plan again, the growth plan in 2007 actually identified central gathering places for neighborhoods, that being parks, schools, something, churches, something where people could gather. And your third point under strengthening social infrastructure, designing the environment to encourage that interaction is so important. So again, relating it back to the growth plan and some of the issues that we're dealing with there. So
Yeah, I appreciate that.
And to add to that, I had written down a note just to comment that in my neighborhood, we recently got a new playground. So the one we had was pretty outdated. It had been there for probably 20 years. It needed some repairs, and so it was taken down and a new one was put up. And I know part of this is the good weather that we're having, but I have not seen so many people at that playground since I've lived in my neighborhood in 11 years. So to see, it was just, I bet there were 20 adults standing there talking while their kids were playing. So just to see how those structures can bring people together in neighborhoods was just a cool reminder of the design factor.
if I could add one more thing.
Of course.
You can probably tell this is a passion of mine. And this isn't something necessarily that the city probably has the purview of regulating. But to give you an example of neighborhoods where there are garages that face the street, people drive their car into the garage, they shut the doors, and if they go outside, oftentimes it's in a fenced backyard. So all of that relates to the lack of interaction between neighbors. And it's something just to think about as we go forward in design standards, everything.
Yeah, thank you both for sharing that. It certainly speaks to the individualistic kind of nature of, America.
Yeah.
Yes, Nathan.
I don't mean to say this, but I think most of it too, just looking at anyway, first and foremost, I just want to say thank you for the presentation. Before it's even done, I just thought that it's really nice. But at the same time, just looking into the strengthening social infrastructure, the first thing that I always think about is safety. Is our community safe enough, for them to come outside, to be able to walk and run and take care of their kids, taking their kids into the playground. And just looking at this is a good thing. But at the same time, people will be afraid, to be out there if the community is not safe enough. And I think that, our Fargo is safe, but at the same time, we need to be able to encourage our people to be out there. Not in this weather, of course, because it's still cold. But overall, I will just say that what Arlette said and Lynn said, that is so true, because it's part of our community growth, and we have all of this in place, why not? Definitely people will be out there enjoying themselves and be around their family and friends, but we need our neighborhood to be more safe and secure first. So that way they can be out there enjoying themselves.
Absolutely. Thank you for that. This is like the most comments we've ever had. All right. There's a couple more ideas here too. More, a push to really reform and examine our digital environments. So trying to evaluate all of our relationships with technology. I would say particularly maybe our adolescents for that. Also ensuring that the digital interaction that we are having does not detract from meaningful and healing connection with each other. If it's becoming a thing of division, we want to try to reshape that. And then just working to deepen our knowledge, so really establishing a more, robust research agenda for us to better understand what are some of the causes of loneliness, what are some of the consequences when we're all socially disconnected like this, who are the populations at risk, right? Are there some that are more at risk than others? And then trying to measure somehow the effectiveness of the efforts that we put in place to increase connection to make sure that they're working. And then finally, kind of what we've been saying, just to cultivate a culture of connection, right? So we can do things at the city level, we can build the spaces, but there's research to say that our informal practices and sort of our cultural norms of everyday life can really significantly influence our relationships. So just trying to foster a community that normalizes a culture of connection. So I'm glad I included these. I debated, but the next few slides are just sort of some little cards. There are these little, I think they called them social connection fact cards, and they're from the Surgeon General's website. I really like these. They're concise and powerful points being made. They actually list the references for the research. So if you're interested, please use them for your own reference. So I'll just maybe pick examples from each one. So, smaller social network size is associated with an increased risk of type 2 diabetes and other diabetic complications, including heart attacks and kidney disease. A couple more. People with strong perceptions of community and belongingness are 2.6 times more likely to report good or excellent health than people with a low sense of belongingness. There's a couple others there. I thought this one was interesting. Immersion in local community-based activities such as volunteering significantly increase the likelihood of unemployed individuals becoming employed. So just offering these opportunities for people to overall increase our community's health and well-being. Okay, and then we'll switch gears. It wouldn't be a health officer update if I didn't talk a little bit about COVID and flu, so I apologize. But I just wanted to draw to your attention that this is a kind of a busy graph, but in the United States, we are officially in epidemic mode for fall and winter respiratory season. So RSV, COVID-19, and flu are all really rapidly increasing across the nation. So the CDC tracks what is called influenza-like illness, which is what you're seeing here. And this reached epidemic level threshold this week for the US. And I would say this year continues to land somewhere between pre-pandemic years and last year, so it's not too unexpected. RSV is very high in our southern states. We're starting to see rapid hospitalizations of that here. It usually starts in the south and expands outward, so not too surprising. Also, our COVID-19 wastewater, which we sort of now use as an early indicator of transmission, has been increasing nationwide as well. And then influenza has just been rapidly increasing pretty much everywhere. This is US vaccine rates. So just to point out that vaccine uptake for our respiratory diseases is unfortunately subpar. It's lower than we would like. The latest data, at least as a country, shows that COVID-19 in adults, so in people 18 and older, and our RSV vaccination, particularly in that vulnerable group of 60 and older, that they remain significantly lower than influenza rates. So not doing as well as we had hoped with rolling those out. Here's how we're doing in North Dakota. I just grabbed a screenshot from the most recent update here. We have several markers of influenza activity that are kind of trending upward from last week in our state. We've had 3 new hospitalizations due to the flu. So it's now still a great time to receive your influenza vaccine before you gather for the holidays. It's not too late. And I just wanted to show this, the NDIIS data that we collect can be used to kind of estimate the percent of North Dakotans in each age group that have received at least 1 dose of influenza vaccine each year. Adult immunizations do not have to be reported to this system, so it's possible the coverage rates are higher. And unfortunately, we don't have real-time data from this season. The state will put that out at the end of the season, but I did grab this here. You can see it from last season, 2022, 2023. We don't do that great. I mean, even in our most vulnerable, I would say the 65 and older, we're not even at 50% for getting a flu vaccine statewide. So we're hoping to increase that with our public health efforts. From calls I've been on with the HHS, uptake seems to be on par this season with previous seasons. So they aren't seeing dramatically lower, but they certainly are seeing higher as well.
I have a question.
Yes,
Sorry.
please.
Is there a reason why our state is hesitating from taking the flu vaccines and just in
You know,
general?
it's interesting. Nationwide, I would say pre-pandemic, we were like breaking records and we were doing very well with the flu vaccine. I would assume that it extends to North Dakota, but I think overall there's just been a vaccine hesitancy around, vaccines that we've done for many years, including influenza. But
Is there a reason why they don't want to take the vaccine? I know I'm trying. I know you kind of going around it, but it's,
yeah, I think
Is
that
there
reason,
like-
it varies, it depends on people's concern. It depends on maybe they think they're not at risk for influenza. Maybe they think the flu shot doesn't protect them. I've heard various reasons. But we do know that flu vaccine is certainly our best protection for keeping all ages really safe, but particularly the extremes of age, the really young infants and people 65 and older who tend to fare worse with influenza.
And vaccine hesitancy isn't limited to COVID vaccines.
No,
or
that was
it's
kind of
really
what I was
straight
trying to
across the
say.
board.
We're seeing this even with our kindergarten vaccines, which I've updated you guys about, and I think that's just bled over into even seasonal flu shots. Yeah, but it was lower last year than we're typically used to, so.
all right. Thank you.
Yeah, sorry, I always come with bad news.
No, it's okay.
Maybe just in the interest of time, this was just a brief, quick snapshot of COVID. This is a little hard to decipher. We aren't really tracking cases as much anymore to statewide, but I do glance at this every once in a while to look at our statewide hospital capacity because I think that's important. So as of a few months ago, you can kind of see where we were with that. And then back to COVID vaccines, we're doing, fairly well as a state. So this is showing you statewide levels of the first column is everyone. So for example, I don't know if I have a pointer here, but this guy is everyone 6 months and older in the state who has had at least one dose of some sort of vaccine since the pandemic started. And we're at, almost 56%. So where we get into trouble is the very low amounts of people who have had at least one of the updated boosters for this fall. And I would particularly call your attention to the really vulnerable group here in our older. We're only at about 21%, which I think leaves people, I think this is an area we could do a lot in public health with, because if 79% of that group have been willing to take a vaccine, how can we be better about getting them to take the most updated booster, right? This is levels for Cass County. So doing a little bit better across the board, almost 65% total. We're doing better in that really vulnerable group with updated boosters. And then again, my little plug that it's not too late. I really love this graphic. It goes through all the vaccines that we recommend in particular for fall of this season to keep yourself safe and your family members safe as you gather. One note on the RSV monoclonal antibody there at the bottom, that's the new Nirsevimab we are all very excited about. There's a nationwide shortage of that. And from calls I've been on, North Dakota is not expected to receive any further allocations of that, which is unfortunate. So we're kind of using it for our really high-risk infants. But then we really want to be encouraging our providers and public health people to encourage this in pregnancy, because we do still have the ability to protect RSV if we're protecting our pregnant mothers. I believe that's all I have. I was going to say one other brief thing that North Dakota is currently experiencing an increase in pertussis cases. We got an alert about this yesterday, actually. We've had 8 confirmed cases since the beginning of November, which is more than we're used to. 8 confirmed or probable, I should say. So I will be sending you guys actually a separate health officer report to update you on that. But I just wanted to do a plug that vaccines are really our best resource for that in times like this. Every adult needs an updated Tdap booster every 10 years. Our children routinely get vaccinated with DTaP, but if you are a person who's around young infants, like a daycare provider, certainly healthcare workers, but even grandparents, we just really encourage you when we know cases are going around to make sure your vaccines are up to date. I'm happy to take any other questions.
I'll start with my personal plea and encouragement to get your COVID vaccine. So I was able to get my COVID booster through my employer in October. My husband hadn't gotten his yet, neither did my kids. They all got COVID, I did not. So I think that's a really good case study about the efficacy of the vaccine. And then two questions or comments. The risk for loneliness assessment and screening. I have that as a takeaway to take back to work for social related health needs and assessments. But do you know if healthcare organizations are starting to add the risk for loneliness screening to some of their screeners?
It's a great question. To my understanding, no. And so there are, if you are interested in this, there's like more details within the Surgeon General's report. I mean, obviously, I can speak from the pediatric clinic. We screen for anxiety and depression, and we kind of do the GAD-7 or PHQ-9, on all of our adolescents. There are like little granular questions about loneliness in there, but I don't believe it's like a specific question being asked.
And that goes a little bit more upstream, right? So if we screen for suicide, if we go upstream and screen for depression and anxiety, go upstream even further and screen for loneliness, that can help us identify those patients at risk sooner.
100%.
So I'll bring that back to my employer. And then the digital environment. So at my children's elementary school last year, we won a national PTA grant on digital safety. And we were able to then have a ton of resources and education throughout the year. Does public health have any sort of campaign or resources on digital safety programs? Because we do it in the school, at each individual school if they have the resources, but I'm just curious if there's anything on a public health
We looked at
level.
Desi or Holly.
Yeah, I don't think we have anything at this time.
I'm not
that I'm aware of.
There's a ton of good stuff from National PTA I could maybe share with you guys. It starts at home, the conversations with family, and also contributes to mental health, concerns. So I'll send you guys some
Yeah,
things
that
I
would,
have.
that would be perfect, Lynn. And like I said, there are some things that we're starting to get into that we've never done before, like the, gun storage safety and different things. And that to me is another one of those things where it's information and awareness. And whether we're putting it out on a social platform or whether we're sharing that in the school newsletters from the school nurse office or something like that, that would be beneficial.
Okay, perfect. Any other questions for Dr. Newman?
No, I just think that mental health overall, it need all of us, to be able to be around our friends, our families, anybody's, who definitely need the help that they probably need even at the provider office too as well. So it's so crucial, including digitals, because it's so crucial for our kids to be able to be protected, because there are a lot of predator out there, who just wait for the kids, to as soon as they lock in and thing like that, or they just gather all your details and info. I had one, mine almost $2,000 off of there on my account because somebody took them. So it's so important that you have to be really careful, with the kids and thing like that. So
Yeah, there's physical safety, financial security,
Yep.
and mental
Everything.
health. So
Related to the vaccination rates, I know something that I see at where I work a lot is the need to educate on the ability to co-administer the vaccines. Like we have a lot of people that will schedule a flu vaccine, but then that also initiates that discussion about the COVID booster that's available, and the RSV vaccine, and that. Let's poke you 3 times in your one visit versus having you come back 3 times and dealing with some of that logistics with that. And then related, I just had one comment too I wanted to add on the growth plan and the isolation discussion is, a lot of this fits in, a lot of that discussion fits in to the blue zone concept in that. And I know there were some discussions around that at one point in time. I was just curious if there's still efforts underway kind of looking at the blue zone as well.
So they didn't go forward with the
Okay.
blue zone portion. There was a little, hybrid version of that they were working on that was like an FM Wellness Coalition. That too has kind of changed course a little bit. They've done some initiatives through that. I think Clay County is going to be kind of spearheading one of those initiatives coming forward, but for the most part of that's kind of just on hold at this point.
And they did do a Blue Zone site visit in 2020, and I was on that planning committee, so I can update you on a little bit of that background and where the decisions ended up. But I think there's still opportunity, no matter what way we go, to have, a county, Clay County, Cass County
Yeah, I've just been really
initiatives.
grateful that health has a voice in the growth plan. Desi and I both kind of sit
Mm-hmm.
on leadership boards or executive boards for that. And it's, things you were brought up, walkability and transportation and access to groceries really matters in the way you design a city for our overall health. So I've been grateful that we've had a seat at that table. Definitely. Well, thank you.
Thank you very much. Okay, our next item on the agenda is winter warming initiative.
Good afternoon. I'm Brenda Derrig, and I am the Assistant City Administrator. I am new to my role. I just started this summer. I am not new to the city. I've been with the city for over 30 years. But one of my opportunities I got in my new role was being able to collaborate with health and fire and planning and emergency services on how to handle the winter weather and how it's impacting the unhoused. And so it was a really great opportunity for me to collaborate with the different departments and to look at different options for plans and to come up with a final plan that we could move forward with. We did have ARP funds available from the previous year that had already been designated for winter sheltering. So we'll be using those to help support this initiative and then work through the winter on writing the plan and being able to circle back to our leadership group and let them know how things went. But with that, I'll let Desi and discuss a little bit about the specifics on the plan.
Yeah, thanks, Brenda. It's been really nice to have city administration supporting us in this role as well. So we knew going into this winter season that our shelters are already at capacity, and so we knew we were going to have an issue. Last year, we did see, a lot of frostbite cases, different things, and so we know that the elements here are very unfriendly to people being outside. And so we also knew we weren't going to be able to solve the whole issue of meeting everyone's needs that are unhoused, but having this overflow space has, provided a little bit of a help, going into this winter. So because this was kind of a collaboration and we already have our harm reduction team who is experts at providing care. We had our downtown engagement center site. So that's really where we landed on to have this program start. We did actually do a soft opening last night. How it's going to work is that we would do, so we have our normal deck operations that are from 8 a.m. to 5 p.m. From 5 p.m. to 8 p.m., we have a transitional period where our normal deck operations have stopped. But from that 5 to 8 p.m., we'll be able to work with guests on what are their options for sheltering, trying to determine do they need transportation to get to certain places before the nighttime, and help to get them figuring those things out. And then from 8 p.m. to 8 a.m. is the winter warming overflow. And really, this is not shelter beds. This is basically like an airport seating type setup where we have chairs and the lights are on, and it's just on the main floor of the engagement center. So we have staff there to help and work with people. And so this will actually go through May 1st. So we will have that options. We have capacity to serve about 38 to 40 people for extra, and we do have to maintain that capacity for staff safety and everyone else's safety. But again, we're still going to keep up that communication with the other local shelters. That's going to be a big part of this, like figuring out what they can do for overflow, what we can do for overflow. And I think that will just help. But I think anything we can do to help people get inside and out of the elements is really a responsibility to do that. And it was wonderful that we were able to use, the ARP funds from admin. We had some workforce grant funds too that were supporting the staffing for this. And so I I think it's going to be a really good thing. I think the intent will be, if this goes well, that this would be a model that we can use, year after year, but we'll see how it goes through the season and then evaluate when we're done, and hopefully we'll have a really good story to tell. And just really wanted you guys to be aware that this was happening, so that if you got questions, and again, it's a City of Fargo initiative, but Fargo Cass Public Health is supporting that staffing piece.
I'm Chair. So you mentioned that there's not going to be any beds. Can you expound on that a little bit?
Yep, so because of various we don't have room for probably to put beds out, but from a fire code and different licensing kind of perspectives, you can do that airport type seating and not need any higher
Okay.
things to support
Sure.
that. And so that's really why, because it is kind of a temporary thing, we had to kind of pull things together pretty quickly. And the deck was set up for services, but it's certainly not, that main level is not set up for shelter beds and different things. So, and it really was the intent to be that overflow capacity, and how do we handle that? We weren't looking to set up another full-on shelter. And so that's really what we needed to do, to meet that immediate need. That seemed to be the most logical thing to do.
Okay. Any other questions on the winter warming initiative? Okay. Next item of business is the ending homelessness discussion.
Lori's going to help me get a few slides up here in just a second. Hello, everybody. My name is Chandler Esslinger, and I'm the community liaison for Fargo Cass Public Health in the Harm Reduction Division. And I'm here today to just provide an update from Harm Reduction on the work that we're doing in our community, and really how all of our programs in Harm Reduction are designed to get us closer to ending homelessness. But first, I wanted to share a quick update. Earlier this week, we had the FM Coalition to End Homelessness Annual Conference, and the Harm Reduction Division went away with 3 of the 6 awards from the FM Coalition to End Homelessness. The Downtown Engagement Center was actually recognized as the community champion in ending homelessness. Our data specialist, Sydney May, at the Engagement Center went away with Rookie of the Year. And then I was actually honored with the award for vision and dedication to ending homelessness. And so we are just so proud to be recognized for the great work that happens in our division that does get us closer to ending homelessness, and wanted to share that celebration with all of you.
Congratulations.
Congratulations.
Yes.
Thank you.
And thank you for doing this, because I was going to do it at the very end. So great. I'm glad you did it.
We're pretty good about celebrating the hard work of our staff, and are really proud to be able to do the work that we do. In addition, the whole point of the Coalition to End Homelessness, again, is to get us closer to ending homelessness. And the main focus of one of our keynote presentations is really about what are the ways some other communities have ended homelessness, and is it something that we can do here in Fargo? And what we were really able to take away from that is actually, yes, homelessness is solvable, and it's something that we can take strategic action on to address. There are other communities of all sizes, larger and smaller than ours, who've been able to end homelessness, especially for specific populations like veterans, those who are chronically homeless, and those who are living unsheltered, and that we can do it too. And actually, we're really the most well-positioned we've ever been as a community in order to take those strategic actions to address that unsheltered chronic homelessness, and then continue to set goals around those best practices to eliminate homelessness altogether. So part of the work that needs to happen in order to get to that place is really creating a community movement around ending homelessness. It's not just one organization, one public health division. It's not one organization's job to do that work specifically. It really does take the entire community. And so in January of 2024, we will have James Matthey, the housing administrator for Milwaukee County, coming to Fargo to present to a variety of different groups on what they were able to do in their community. And I wanted to highlight that since Milwaukee adopted their plan for ending homelessness, they have seen a 92% reduction in unsheltered homelessness. And as recently as April of 2022, they actually had the lowest rate of unsheltered homelessness in the nation. So although we know as a nation, homelessness has been trending upward because they were able to functionally end homelessness in their community, even when numbers start to rise, their system is well positioned to address that immediately. They don't have to reinvent the wheel. All of those pieces are already in place. And so we feel like this is a really great opportunity to get all of the stakeholders together, especially those who experience homelessness most acutely in our downtown community, to listen to some of those best practices, identify the role that they could potentially have in supporting this work, and just really building that momentum and charting that path for where we want to go as a community. So we will be sure to get that save the date out to all of you when we have solidified that date. We're working around a variety of schedules and want to make sure to maximize the number of people who can participate. But it's really meant to be that educational event and community conversation to work through some of those big clunky issues and conversations we have to have before we adopt a community-wide plan. I also wanted to, in the same vein, highlight the recent kind of structure that was released around the Ending Homelessness Task Force. The city administration and FargoCast Public Health worked collaboratively to kind of put together this framework. And I think it can be confusing for people to kind of understand what this looks like as we try something new. And so just wanted to provide a high level overview of the intention of the task force. And so as you can see on the screen, this Mike Redlinger actually put this together for the most recent two city commission meetings ago. And the Ending Homelessness Task Force is made up of two groups. So both groups make up the task force altogether. One group is a group of dedicated decision makers and policy leaders who can act on the recommendations of local homelessness response leaders, who really are the content experts on what it would take to end homelessness in our community. They know the gaps, they know the best practices, and they're able to activate the system to move in alignment with those best practices. And part of what it takes to end homelessness is creating an environment in our community where ending homelessness is possible. And that's really something that's done through policy. And so the city's role is really seen as creating those policies from the recommendations of the homelessness response system to help us effectively and efficiently move people into more stable housing. And that really looks like maximizing access to housing in our community in a variety of different ways and maximizing the efficiency of the homelessness response system. So with those two groups working together under the umbrella of this task force, we believe that we'll be able to make some really concrete recommendations that will lead to solutions that all of us will be able to see and feel rather quickly once they're implemented. I also wanted to provide some high-level data about the national and local trends we're seeing in our community on homelessness. We are awaiting the release of the Fargo-Moorhead Coalition to End Homelessness State of Homelessness report. It was set to release this week, but I have not seen it go live on their website yet. So once that is, we'll be sure to follow up with the Board of Health and make sure that you receive that report. So in lieu of that specific data that will come out of this report, these are some of the trends we're seeing both nationally and locally. So from 2007 to 2016, homelessness across the nation had actually been decreasing at a rate of about 17%, but it has been on the rise again since 2017 at a rate of about 6%. One thing that was unique about the most recent assessment of homelessness across the nation is that for the first time since data collection on homelessness began, more individuals are experiencing homelessness that are unsheltered than sheltered. And so this is something we can see in our own community with the visibility of people who are living unsheltered.
Chandler, can I ask a question there?
Absolutely.
So, any rationale or reasoning behind why more are unsheltered? Is it a lack of beds? And what happened to the beds that we had back in 07 to 16?
You know, there are a variety of different factors that have a role to play. Some experts have said that this actually might be influenced by the pandemic and some of the social distancing restrictions that were in place at those congregate shelters. And so people were forced to not access those shelters because there was limited capacity. As those things have loosened up, what we also know is that just the rate of homelessness is increasing. And so if additional services or housing options aren't available, that means that, you know, those folks just don't have any other place to be rather than outside. Another unique factor to that unsheltered homelessness is that 62% of people experiencing chronic homelessness are living unsheltered. And chronic homelessness is really defined as somebody who has been homeless for 12 consecutive months, or I believe 4 times within the last 3 years has had a period of homelessness, and they also have some type of disability. And so this again just highlights that there's a really vulnerable population of people in our communities who are living unsheltered as well. And that's something that just makes homelessness more traumatic, and it makes it more difficult to kind of help move people out of that situation when they have that combination of factors impacting their homelessness. As was already mentioned, part of the Winter Warming Initiative, the city did conduct a survey on the number of shelter beds available in our community on any given night. And on average, there are 330 emergency shelter beds available in the Fargo-Moorhead area. What we know is that since summertime, shelters have been overfull in our community. They've been serving overflow capacity even before winter weather has begun, and that's abnormal. Typically, we don't see that in our community. So what that tells us, again, is that that rate of homelessness is increasing, and that need for services, the need for housing, the ability to move people out of shelter and in a more stable place to live is just not happening as fast as people are experiencing homelessness. So I just wanted to draw that connection as well. One of the really important pieces of data we have that demonstrates the level of people who are at risk of homelessness in our community, the prevalence of that, is data from Presentation Partners in Housing and their collaboration with FirstLink on their homelessness prevention data. This is a crisis line that families and individuals can call into when they are at risk of or currently experiencing homelessness. And what they saw in the most recent program year compared to last was a 65.8% increase in the number of households calling in, identifying as either homeless or at risk of homelessness. So again, the data is really showing us that this is an issue that's trending upward in our community, and something that really requires strategic, coordinated action in order to address. Kind of the current state of affairs is not sufficient in addressing this issue. In addition to these trends, we also wanted to highlight that wait lists in North Dakota for housing are long. They are congested, and especially when we talk about that chronically homeless population, from the time they are assessed for housing to the time they actually enter into housing, it can be 7 to 8 months before that actually happens. And about 70% of the people in North Dakota who are on the housing prioritization list are within Fargo. So we have a really unique kind of situation in our cross-border community here. One of the other factors that kind of relates to that length of homelessness is the fact that vacancy rates in our community are extremely low right now. We're at about a 3% vacancy rate. And so when people have kind of a complex background, whether that's an eviction on their record, maybe a poor credit score, or any other barrier to tenancy, it can be really difficult for them to be the one who's chosen for that housing. And so that, again, kind of puts additional force on the homelessness response system when we're not able to quickly move people out of shelter or unsheltered homelessness into that more stable housing. So with all of that data and information in mind, knowing that our community has identified that Ending Homelessness Task Force and has a desire to adopt a community-wide strategy for ending homelessness, we wanted to open it up to the Board of Health to discuss what they see as their role. We know homelessness and housing is a health equity issue. It significantly impacts the health and well-being of our entire community. And so happy to answer questions as you all kind of discuss maybe what that looks like or any feedback you may have on my presentation.
Madam Chair?
Yes.
Yep. Thank you for the information. By way of background, my county commission role, obviously, and I also currently chair the board of directors for the Downtown Community Partnership this year. And I don't think there's a day that goes by in the last 4 months that I haven't had some interaction on this topic. And there's, as I think everyone would imagine, there's a diverse set of opinions. So a couple questions maybe. One, you'd mentioned best practices, those that have solved this. I'd like to know those communities, if you could share, their locations and just do some Google work and read about it. And it's great. I think you're bringing in Milwaukee, but if there's some more tangible things that are success attributes to these cities or counties, whatever that you reference, I'd like to have that, to read about it. And then the second maybe is more broad with your data and trends and collection. My time on the city commission years ago, and as well as now in the county with law enforcement, are they regularly engaged in your data set collections?
We coordinate very closely with law enforcement, just in general, but I don't know that they are supplying data necessarily to us about anything that they're doing.
Okay.
With the homeless
Well, my curiosity around that question, and I'll expand. I know individuals who have raised children in South Fargo. They've lived here all their lives, and they've struggled with mental health, and they're in their early 20s, and they're homeless in our community. And I believe there's a lot of nonprofit efforts to go to try and help that individual, in this case, a very close friend. And it's been a constant challenge. And this individual is homeless in our community. You talk to law enforcement, and maybe some of this interjects itself into the downtown Fargo environment. And the Native American population, they're individuals that are basically told to leave because they need help. So they migrate to the community, whether it's our community or Bismarck, and that's a different sector, I guess, if I can use that word, of a homeless individual coming here and needing services. And so that's the curious part of my as I interact with all people's opinions on this, is that there's a number of different categories, and I don't know if that's the right word to use or not, but how do we solve this when we have these different demographic groups that we're dealing with? And that's the part that's really intriguing for me, is from a law enforcement standpoint. They'll be very direct with you as far as what they see. And if you talk to the folks at the county jail, I've asked them for data that kind of tries to separate this, at least from a standpoint of the data and the trends, to make better decisions. And I hope I've articulated that well enough. But those are the curious things with me, and a lot of times the often very diverse, strong opinions I receive.
Yeah, I've heard similar kind of conversations, because we do collaborate with all of those entities as well. I think recently what I heard was that the Cass County Jail, about 40% of people do not have a permanent address. And so I think, what we really think about is there are specific ways that we can improve our system so that we can move people quickly out of their situation and into more stable housing. There's a variety of reasons why people experience homelessness. But what we have control over are what we do when somebody presents or is at risk of homelessness. And so how do we maximize the efficiency of that system? And that's really what a lot of those best practices hinge on, is using the opportunity that we have within local government, within our local nonprofits, to enhance and maximize that system. So I will definitely share those best practices with you. And, we feel really strongly that everyone in our community is harmed by the existence of homelessness in our community. And so it benefits all of us for us to address it, and are really hopeful that that momentum will continue us into a future state that all of us want to see.
Naima?
Thank you. Well, thank you, Chandler, and congratulations to about your awards. That mean a lot. When we discuss about the homelessness, like what Tony said, there are a lot of groups, in our communities that are from different backgrounds. Personally, because I'm originally from South Sudan, we had a South Sudanese guy actually die under the bridge, and most of it is because we turned a couple of people away, and they don't have places to be able to sit in. So if those, and I believe that it's not only that South Sudanese guy that passed, there are other people that passed too, within our community. The question is how are we going to expand the rooms or the shelter that we have so we can have more people, especially when the winter, like right now, winter is approaching. Are we going to continue to turn people away who are actually coming in to say, you know what, I needed the help that I need right away? And a couple of months ago, 3 months ago, there were a 6 family member who came here that her husband was abusive, and she wanted to run away, and she came here. They turned her away because there is no place for at least 7 family members to be at. So now if we are addressing the homelessness, why are we turning those people away where some of them are actually losing their lives? What are we doing as a community to be able to address this? I know that you want to address it, and the Fargo-Casa Public Health is helping too for the city. But if the people are dying on top of it, what are we really doing, and what are we really discussing when we can actually stop people from dying?
Yeah, I think these are all really important points that you're bringing up, Niamal. And, there is tragedy associated with the existence of homelessness in our community. I don't represent the entire homelessness response system, and they do all have their own rules around, how their programming works. What I can say from the perspective of harm reduction is that we strive to be as low barrier as possible so that we are ensuring that those folks who are not well served by other parts of the system, where they're not able to maybe meet some of the requirements for participation in those programs, that they still have a place to be. And that is part of the reason why the city endeavored to have this winter warming initiative, is to ensure that people who maybe aren't able to access other shelters for whatever reason, whether they're full or a different reason, do have a place to be. And so that low barrier threshold for services is really what we hinge all of our harm reduction programs around. And so I think that's a question that the larger community also needs to ask itself, is when we know that these are the consequences of decisions that are made in terms of who is and is not served in our community, what are we going to do about that? I know the role we play in that, and it's just one of many organizations in our community that are responsible for addressing this issue.
Commissioner Preston.
So I think certainly by all means, I've heard a lot also about why doesn't law enforcement fix this? And we've also heard from law enforcement that they truly don't know how to address the whole situation. I think, and one of the things that has been, I think, pretty evident in the recent decades is the incidence of mental health issues with those that are incarcerated, and vice versa. Also, we're just seeing more mental health issues out in the community. Can you talk a little bit about the concept of housing first and how that relates to addressing some of the other issues that are probably contributing to even chronic homelessness, but homelessness in general?
Yeah, so I'll say two things. So when we don't have a well coordinated and a sufficient amount of mental health supports in our community, law enforcement does become that de facto response system to that, right? And so we have an opportunity, I think, in our community to enhance and align a lot of the organizations and systems that have a role to play in that, so that law enforcement isn't that de facto response, and that people are getting access to the appropriate level of care at the right time, and not either really the most expensive level of care or kind of left to self-resolve because we don't have the kind of right level of services available in our community. The promising part of Housing First is that for a long time, there have been a lot of requirements that people must meet before they get housing. And what that means is that the length of time homeless and the barriers that people have to overcome in order to be qualified for housing, they're very high. But when we implement Housing First, we are able to move people into housing without preconditions for the state of their mental health or the state of their substance use, and then surround them with the supports they need now that they are housed and able to actually invest in improving other aspects of their life because they have access to that stable housing. And so Housing First is a concept that has been proven to not only keep people housed who have difficulty in some of those areas like mental health, but also just limit the amount of time that people are experiencing homelessness because they're not jumping through all those hoops just to say, okay, yes, now you can have keys to your apartment. And so that is one of the practices that not only Harm Reduction kind of orients ourselves around, but other organizations in our community as well. And if you're looking for efficacy on that way of doing this work, I would really have you go and look at the Presentation Partners in Housing Housing Navigation Program. They have incredible data that shows when you are able to quickly move somebody into housing and keep them housed, they're able to address their mental health. They have fewer calls for or ambulance calls, fewer calls to police, everything is less. And that saves our community a lot of money. And it also invests in the health and well-being of that individual as well as the larger community. So that's a little bit about Housing First. I'm happy to share more resources on that as well, but would really encourage you all to look to that data to see just how impactful that approach can be here in our community.
If I can make one more comment.
Absolutely.
Yeah, it only makes sense that if you are spending your time and energy trying to figure out where you're going to be sleeping that night, especially if you have children, you just don't have the time or energy to be spending on mental health issues. You are truly just looking for a safe environment to spend the night. So it just makes sense.
Right, when you think about Maslow's hierarchy of needs, right? Shelter is the number one thing. Yes.
Thank you for the work you do, Chandler. What type of interaction do you have with churches and faith-based organizations? I also serve on the Salvation Army Board, and I know that every month we get a report as to families coming in that, you know, mothers trying to escape violence or whatever, and the Salvation Army has a program where they give out vouchers, and so there's temporary housing or for whatever their needs might be. And I know that, to Commissioner Grinberg's question, our law enforcement officials do track whenever they come into contact with the homeless population because they're trying to facilitate a warm place to stay or where they can get, something to eat or whatever the case might be. So I know that that data is available, certainly in our department. And then the other thing is that, yesterday or the day before, Arlette and Commissioner Preston and I were on a homelessness task force having a great conversation with John Campbell and his group. And, one of the other things is that I brought to light that there's 131 students at West Fargo high schools, excuse me, we have 3 now, that are identified as homeless, and of course by the school district's definition. But it's my understanding that it's the same for Fargo and it's the same for Moorhead. So the 3 largest communities, in our metro area are, that's 350 to 400 children that are identified as homeless as well. So, what role does Fargo Cass Public Health have in communicating with the churches and those other great agencies that are out there helping, like the Salvation Army? Because there is an avenue there for them to have temporary shelter at least.
Yeah, so I mean, historically, the faith community has played a significant role in identifying this kind of winter overflow need for shelter. There was the Sheltering Churches initiative that existed for, I think, 5 years, and they really met that need for additional winter sheltering for people experiencing homelessness. And so that initiative was only set to be for 5 years, and then it kind of went away. And so ever since then, we've been looking at, well, how do we sustain that effort? And that's really why this winter warming initiative this year was a key focus area for the city. I know that we receive donations from all different types of organizations, including faith-based ones. And, again, I would encourage the community and those faith-based organizations, churches, to consider the role that they do play in addressing homelessness. And, we are welcome to continue to coordinate and collaborate with them. We actually just met with several faith leaders who are going to be providing spiritual services on site at the Downtown Engagement Center. And I think that will also enhance opportunities for collaboration and help them understand kind of the unique needs of the population that we serve. In terms of youth, I don't know that I can speak to that specifically because I work mostly with the adult homeless population. But what I can say is that, the mission of Fargo Cass Public Health in a lot of ways is to meet the needs of some of the most vulnerable people in our community, people who are low income and really need access to all different kinds of supports, whether that's through WIC or family planning or all the other types of services that we provide. And I would imagine that we interface with those families in one way or another in a variety of different ways. But we do have other organizations in our community that focus on youth specifically and youth homelessness specifically. So the Fargo Public School homeless liaison who presented at the Human Rights Commission yesterday, her and I were here together about 24 hours ago talking about this very topic. They have a significant role to play in that as well as those other nonprofit organizations that address youth homelessness. So that's really the best answer I have for that without calling on all my other public health colleagues.
Thank you.
Yeah.
I appreciate this dialogue very much. And as I considered the question about what does the Board of Health see as their role in addressing homelessness, a couple of thoughts came to mind. One, using our voices to spread awareness for how homelessness impacts the community as a whole, objectively, right? Because I heard Tony talk about the diverse range of comments and conversations that happen. So how do we keep it objective? So how do we look at it as a measure of a healthy and successful community? So I was wondering if you could send us some talking points about how homelessness impacts the community as a whole. I mean, you covered a lot of it in the presentation, but just some talking points for us to have so that when those conversations come up, we can keep it, objective as a measure of the health of our community. And then I think another thing is to do some myth busting on the assumptions and stereotypes. Homelessness can really happen to anyone, and I think that's lost on a lot of people. When we look at the lack of stable and consistent resources for mental health as one example, but I really encourage people to participate in the Day of Poverty simulations that are offered in our community. I had the opportunity earlier this year, and if you don't walk away from that with a new appreciation of what it is like to experience some of these things, I'm not sure that you are paying attention during the day. So I think I would like to use my voice to encourage people to do that, because I think that gives a whole new perspective to what these people are facing. And then, of course, down the line is advocating for policy and funding. But really, I think that the two biggest things that I can do personally is use some talking points to communicate what the community members want to know, what's in it for me, that's just how people are. And so how can we get that information to them? And then how do we level set on some of the biases and stereotypes?
I will be happy to provide that for you. My background is in community-wide initiatives that improve health and well-being. And so we talk about housing and homelessness. I really lean on the social determinants of health model to help tell that story. So I'll be happy to put those talking points together for you and assist in any of the other myth-busting or initiatives you'd like to tackle.
Yes, Commissioner Preston. Jamie, did you have anything?
Did you win?
Oh, you can go ahead.
Sorry, I don't mean to.
I think the social determinants of health is exactly what I was thinking as I listened to all this conversation.
Yeah.
So that's a great framework to help address this. You know, one of the other questions that I have is, you know, you've demonstrated well the challenges when someone is homeless and finding housing for them and shelter for them. One of the questions I have too is then how can we address this further upstream before it gets to that point? You know, that's one of the things that I could see as a role and trying to support these efforts.
Commissioner Preston.
So in regard to the question, and I don't know where the appropriate place is for this yet, but at some point, being able to establish as a goal what our goal is for addressing homelessness. You've mentioned a functional zero, I believe, kind of vision. And I don't know if that comes from Milwaukee or if that's kind of a national goal. But at some point, having some discussion around what is our vision, where are we going with this? And, you know, we have a unique makeup here in that we have at least 3, 4 jurisdictions sitting at this table. And it would be, I think, a really appropriate place for us to talk about what is that goal and begin to communicate that out. You know, I do think that there's way too much of a sense of this is not solvable, that we'll never be able to do much about this, and trying to push it back perhaps on other communities, on other agencies, on it's not our role kind of issue. So to be able to get a full understanding in the community of what this means and where we can go with it, I would see probably this board as having a role in that conversation. And in fact, I would hope that maybe in the March meeting, we could begin to see some of that, perhaps.
Yeah, absolutely. Functional Zero is a nationwide best practice that really was born out of the work that the Veterans Administration did to address veteran homelessness. And that's where a lot of these nationwide best practices come from. They really used those veteran assistance dollars and programs to test out what works to end homelessness with a really specific and unique population in our community that has multiple barriers. And so again, I will share out those best practices with you all and would love to continue this conversation at a future Board of Health meeting.
No, I'm good, but social determinant of health is the first place to start.
Yes.
I agree, the upstream identification of people at risk, yeah. Okay, thank you so much.
Thank you.
And thanks for the work that you
Thank
guys
you.
do. And then congratulations on the awards that you guys won this week. Are there any, I don't think there's anyone online for public comments, correct? Okay. So let the record show that there were no public comments. Any other items for business from the board? Okay. We will gather back in March. So the meeting is adjourned today at 1:14 p.m.